Hello everyone, happy evening, a very good evening. Am I audible and visible, everyone? A quick note whether I'm audible and visible, I'm just trying to figure that out so that we can start with the session. Okay, that's great. So here we are into this session, like the most requested session, especially after the FMG results have been announced, right? So how do we start for the upcoming FMG June 24 exam? And the tentative date that has been mentioned on the website for FMG exam. So you have the upcoming FMG exam basically on 30th of June and the NEET PG exam is on 7th of July. So you would see that uh, basically both the exams are very close together, and that is why the timetable that I'm going to share with you today is applicable to the students who are going to appear for the FMG June 24 as well as for the NEET PG July 24 exam. So in this session, I'm going to tell you how basically, you should be planning your day and how many days you should be giving to the subject. How can we do that together? And, any queries that you have related to your preparation, all of that is what we are going to address here. So most important here, the timetable, and the next is also how to use the Medsynapse app. Should you be using the Medsynapse app, and why you should be using it, and how you should be using it, right? So basically that's what we are going to do here. So I know that if I ask this question, how many of you think that cracking this exams, be it FMG, be it NEET PG, be it INICT, how many of you think that it is difficult to crack this exam? How many of you have that thought in your brains, in your mind that ये exam crack करना easy नहीं है, it is difficult? Yes? I'm pretty sure that majority of us have that thought, and I would rather use the word delusion. We have that delusion that cracking this exams is difficult. Trust me, it is not as difficult as it seems. Why can I say that? Because I've been through that journey, I've experienced it myself, and remember that majority of the people around will tell you that बहुत difficult है, and that's why you get that delusion in your brains कि difficult है. But actually if you ask the people who have cracked this exam, the toppers, the good scorers, they would tell you that it's not that difficult. So I am one of those who would be telling you that it is not that difficult, right? So before even we start, understand that everything seems difficult in the beginning, right? Take the example, If you have not been exercising and suddenly one fine day you decide that no, I need to take good care of my health, of my body, so I need to start exercising, I need to go to the gym. Initially it will be very, very difficult, right? You will not have that motivation, you will get those body aches, right, when you go to the gym initially. But once you get into that habit, then it is very difficult not to go to the gym, right? So everything seems difficult in the beginning, but remember, at the same time, it is not that difficult as it seems. You know, when you start going to the gym over a period of time, maybe 1 month, 2 months, 3 months, you would then realize that जितना difficult मेरे को लग रहा था उतना difficult नहीं है. And trust me, post exam and post exam result, you would come back to me saying that you were true, ma'am, it was actually not difficult as it seems. Till the time you are on this side preparing for the exam, it seems very difficult. And once you go on the other side and then you look in the hindsight, you realize that itna difficult nahi tha. Unnecessarily, we were getting so much bothered and troubled by the preparation phase. And honestly, if you ask me, this preparation phase is the best phase that you can have. You have nothing to do but just sit and study, right? That's the entire thing that you have to do. This is, Vinisha, like I said, it is not really difficult. This is actually the most beautiful phase if I look back and see, right? So if you enjoy this journey of preparing for this exam without getting stressed about the result, you know, क्या होगा, exam कैसे होगा, will I get my dream branch, will I not get my dream branch, don't think too much about the future, right? कि क्या होगा, कैसे होगा, जब होगा that time हम देख लेंगे. Whatever is in my control, that is today, is what I will be focusing on. So during this preparation phase, just take one day at a time, right? So if you think of, climbing the ladder, just think of one step at a time. You will never realize when will you reach to the top. अगर पहले से ही देखोगे कि I am here and I have to climb to that mountain, I have to do so much of trekking, it will seem very, very difficult. थोड़ा थोड़ा करोगे, साथ में करोगे किसी के guidance में करोगे, it will become very easy. Okay? So, Crazy PG, there are some videos, the free videos section which is available in the Medsynapse app. You can definitely check that. Okay? हाँ, ये subject wise timetable है, is what I'm going to share. So, this is something that I had shared in the last session, YouTube live session also, where I had discussed a 100 days plan post NEET PG postponement. That is the ongoing timetable that we had. The timetable that we have ongoing there is actually a system wise timetable. So you have a subject and a system alternating in that timetable. So if anybody wants to check out that timetable, you can see the last YouTube live session, 100 days wala. And it's also available in my Telegram channel, Dr. Nikita's Medsynapse, in the pinned messages. So currently in that timetable, we are ongoing with the system of neurology, right? So today in my Telegram group, I also shared the TOTDs, that is the topic of the day, कि आपको न्यूरो एनाटॉमी में से कौन से वीडियोस मेडसाइनैप्स से देखने हैं, न्यूरोफिजियोलॉजी में से कौन से वीडियोस फिनिश करना है, न्यूरोफार्माकोलॉजी में क्या देखना है, right? So at every step, I'll keep you telling that how to also approach the videos in the Medsynapse app, okay? So this is something which is very, very important, the 4 pillars to crack the exam, the 4 content pillars and the 4 pillars for good life. Even before I talk about anything else, this is something that I want to talk about because this is what we tend to neglect when we prepare for these exams. You know, we think that this is our life, like just cracking this exam is what my life is dependent upon. But please do not make that mistake. Whenever, whatever you are doing in your life, at whatever stage of life, remember that you have to take care of these 4 pillars. You know, जैसे कार है, उसके 4 चक्के हैं, एक भी चक्का अगर पंक्चर हो जाएगा तो कार चलेगी नहीं, एक्सीडेंट के रिस्क बढ़ जाएंगे, and sometimes that accident can be fatal as well. Similarly, if you neglect any of these wheels, the 4 wheels of your life car, remember the accident risk increases. So please take care of your PQ, IQ, EQ and SQ every single day. PQ is your physical quotient. That means please take care of your health as well while you are preparing. IQ is your academic part, the preparation part. EQ is basically your family and friends, the loved ones. Spend time with them every single day, right? And SQ is basically the spiritual quotient. This is something which is very, very important. Especially this makes you prepared for your upcoming residency. Remember, residency is not all like the golden phase. You're going to face a lot of difficulties in your residency as well, right? So the SQ basically helps you to sail through the hardships that will come in your life, that have been coming in your life. If this is strong, you can sail through anything, right? And I believe that in today's generation, this is something which is very, very weak, and that is why we read so many incidents of, the unhealthy incidents happening, the suicide rate increasing, because this is what we tend to neglect. So please do not do that. Every single day, dedicate time to each of these pillars. Now I'll come to your IQ part, that is the academic part. So when you have to crack any exam, be it FMG, be it NEET PG, be it JIPMER CT, remember the 4 pillars. Again, each of these is important. Your concepts have to be very, very good, right? In your MCQ based exam, remember your concepts have to be good. If on a particular topic, the question has been asked in a twisted manner, that is what we are seeing in the FMG exam as well, the NEET PG exam as well, you should be able to answer that question. तो सिर्फ रट्टा नहीं मारना है कि ठीक है ये क्वेश्चन है तो इसका आंसर ये है. You need to understand the concept behind it. You know, subjects like physiology, biochemistry, all the subjects, the concepts have to be very, very strong. Next, where there are no concepts, right? PSM, okay? Example, PSM, microbiology, there are a lot of things that need to be marked up. Remember that with mnemonics that help you in decreasing the number of revisions. एक बार पढ़ो लेकिन अच्छे से पढ़ो और ऐसा पढ़ो कि कभी आप भूल नहीं पाओ. So that is what is very, very important. Once you are done with this, any subject that you are preparing will have a conceptual part, it will have the mugging up part. So concepts and mnemonics have to go together, right? Once you are done with that, you have to do MCQ solving, right? I'm telling you the areas where students generally tend to make mistake. So we do this theory part, the notes part तो हम कर लेते हैं हर जगह से. We try to hoard the notes of the various coaching institutes, हर platform के notes. I'm pretty sure that you all must be having all your PDFs in your iPads and tablets. हर जगह के notes होंगे, हर जगह का content होगा. But remember, it's not really important to hoard and gather so much. What is more important is you stick to one primary resource, right? It could be like one subject, one resource. That's what you can stick to. It could be multiple platforms in that case. For example, you might do a subject A from the platform A, subject B from the platform B, right? You can take a call for yourself. How do you take a call? You can watch some YouTube videos of the faculties available and you can decide for yourself कि मुझे किसका समझ में आ रहा है, ठीक है? So stick to that primary resource for a subject, right? Then practice the MCQs. The FMG students particularly, the FMG passing rate is less, I believe, because we tend to neglect this part. हम सिर्फ theory पढ़ते रहते हैं and we don't practice the MCQs, right? Yeah. I'll come to your queries. All of you can keep writing your queries in the live chat. For the time being, पहले सुन लो and then I'll come to all your queries. ठीक है? MCQ solving is very, very important, right? And remember that MCQ solving has some skills that needs to be developed. ठीक है? It is not just that अगर आपने ये theory notes पढ़ लिया तो आपका MCQ solving भी अच्छा है, ऐसा नहीं है. This is proved by the fact that not all the university toppers of your colleges get the great ranks in these competitive exams. That itself proves that just being good with the theory does not mean that you are good with the MCQ skills as well. The students especially who participate in a lot of quizzes, who have participated in competitive exams, right, in their school days, college days, MBBS days, they have very good MCQ skills, right? So never mind if you have not been able to do that, but at least whatever time you have now, dedicate some time every single day to practice the MCQs. And that is where I personally help you with the KBMD sessions on the Medsynapse app. What is KBMD? basically is Kaun Banega MD. So that's a fun way of saying We discuss the MCQs live. I tell you the cheat codes as I call it, the cheat codes to solve this MCQs. अगर मुझे आंसर नहीं पता है for a particular question, how do I logically guess the answer to this? And trust me, these cheat codes help you get those extra marks and boost your rank for sure. Right? So KBMD sessions is where I help you with the MCQ skills. And the fourth important pillar is the revision. Another commonly done mistake. What we tend to do again is we keep reading. पहले ये platform के notes पढ़े, फिर ये platform के notes पढ़े, फिर third platform के notes पढ़े. Bas we keep reading. And in the process, we forget how much of whatever we are reading are we actually retaining. Being able to reproduce in the exam, in the grand test is something which is very, very important, right? So remember that, stick to one primary resource, right? Whatever you are starting with, stick to one primary resource and complement it with the Medsynapse app, right? The Medsynapse app is available on both Android and iOS. Remember, it is Medsynapse by Dr. Nikita, where basically I cater to all the 18 subjects. The 19 subject radiology has been catered to on Prep Ladder. The rest of the 18 subjects have been catered to on the Medsynapse app, right? So first question that I would like to answer here, because I receive this so frequently, and that is, ma'am, I'm already using some other platform. Do I need to use Medsynapse? And if yes, how do I use it? Right? So is using the Medsynapse app important if you have already finished reading as well? And I would say it's an absolute yes. Not because it is my app and not because it is my personal gain. More than that, as your well-wisher, trust me that the tricks, the mnemonics, the cheat codes that I tell you is something that is the USP, the unique feature of this platform that I deliver on this platform, right? You have read from your primary resource, but you are not able to recall in your grand test. You feel that your grand test scores are stagnant, they are stuck. This is where the Medsynapse app will definitely help you. It will help you significantly in remembering the content, so that even if you don't revise before the exam, you will be able to reproduce that in the exam, and that is what I can definitely vouch for. Okay, so it's an absolute yes, that you have to use the Medsynapse app no matter what level of preparation you are at. Whether you are starting now, you are done with one read, you are done with one revision, two revisions, whatever. The Medsynapse app is like the cherry on the cake, right? That completes the cake. Without that cherry, the cake is incomplete, right? So you have to use it. Second question, is it a standalone thing that I can use? Basically, I don't want to use any other resource. Is it the standalone enough? The answer to that, the honest answer to that is no. Currently, what I have focused more on is basically the short topics, that is the core topics, the topics from all the subjects that are must know for your exam, right? I'll also show you the topics that have been covered to give you a glimpse of that, right? So on the Telegram channel, like I said, today I shared neuroanatomy, neurophysiological topics. So you see that majority of the important topics have been covered. Cerebellum, thalamus, hypothalamus, basal ganglia, spinal cord tracts, internal capsule, all of that, the short core topics have been covered, right? So basically, this is dependent on your 80-20 rule, the Medsynapse app. That is basically your 80% of the questions in the exam come from the 20% of the topics. And that is what the Medsynapse app is focusing on. So I'm not telling you that I'll give you everything 100% of all the subjects, but whatever I'm giving you on the app is something that you would absolutely love, because the way it has been taught, you will never ever forget it. And this is true for all the 18 subjects. So the Medsynapse basically is your core, rather than using it as your last minute revision thing. If you are starting your preparation now, the FMG students, the NEET PG students, start with the Medsynapse videos and then go on to rapid revision of whatever platform you are using, right? Rather than using the main videos of the other platform, you can start with rapid revision. If any topic you are not understanding, then you go to the main videos, okay? And then you supplement it with the MCQ practice, okay? So I hope this is clear that using the Medsynapse app is very, very important, and you can try it for yourself. Give a grand test before joining Medsynapse, give a grand test after joining Medsynapse, and you would see the difference for yourself. Okay. Now coming to the content pillars. What are the 4 important content pillars to crack the exam? Like I said, rapid revision of any platform, whatever platform you like. Then the Medsynapse app, basically to add on, to build up, to help you remember the stuff, to help you develop the MCQ solving skills. PYQs is something that you cannot neglect at all, and the first aid. So basically the fast series that I take on the app, the first aid simplified teaching, you will see a folder in the Medsynapse app where the USMLE first aid step 1 book kit topics have been decoded. It's a difficult book to read if you do it by yourself, especially initially, but later on with the fast videos, you will get a hang of it. Okay. So all of this is being catered on in the Medsynapse app again. So this is what is very, very important. Now coming to your actual timetable that you have been waiting for. So this timetable that I have made is basically in sync with the ongoing timetable that is already there. That is the system wise timetable. Okay. So this is in sync with the ongoing system-wise timetable. So for a student who wants to follow this subject-wise timetable, this is a dedicated subject-wise timetable, you can start following this timetable as well. Especially if you are not giving the AIIMS exam and you are focusing on the NEET PG exam, and this is the go-to timetable for the FMG students, right? So what is the plan? The plan basically is, मैंने ये 15th से start कर दिया, so basically it's starting from today itself. तो एक दिन आपका already कम हो गया है, so sorry for that. So what's the plan basically is, just let me see the live chat, somewhere it has disappeared. Give me a minute. Just a minute. Okay. So few queries there. Will you give Medico 1606 asking, will you give TOTDs for those who will follow this timetable? Yes. So I'll help you basically understand what all has to be covered. This will not need a lot of TOTDs here, but if you want, I'll definitely help you there with that as well. Rahul is asking, is 4 months enough to clear the exam if we utilize full notes and full effort? An absolute yes. You know, I always give this example. It is not just the hard work which is important here, it is the smart work which is important to crack this exam. So do not run behind watching the main videos of any other platform. Just stick to the 4 content pillars like I said, the rapid revision, the Medsynapse videos, the PYQs, and the first aid. Okay, this should be good enough to crack the exam. Okay. Rahul, don't worry. It's absolutely fine. If you have not been able to crack the exam this time, trust me, when, few years down the line, you will not even remember this, and not even any of your patient will ever ask you whether you cracked the exam in the first attempt or the second attempt or the third attempt or the fourth attempt. ठीक है? ये सब temporary है, whatever it is, whether it is success, great scores, or whether it is no success. Basically, everything of this is temporary. Even someone who gets rank 1 in AIIMS or rank 1 in NEET PG, रेसिडेंसी ज्वाइन करने के बाद एवरीबडी इज एट द सेम लेवल. किसी को याद नहीं रहता कि अरे इसका रैंक 1 आया था नीट पीजी एंड दैट पर्सन डज नॉट गेट स्पेशल ट्रीटमेंट. So be it success or be it failure, remember everything is temporary. Okay, everything is temporary. Like it is said, don't take the success to your head and don't take the failures to your heart. Don't let any success make you like that high-headed or an egoistic person, and don't make any failure think that you are not worth it. right? So one exam result absolutely does not define your worth. And I'm not just telling this for the sake of telling, trust me, right? Have been there, seen that, everything. Trust me, in the end, it really does not matter. And keep telling to yourself that my success can be delayed, but it cannot be denied. आज नहीं तो कल मुझे सक्सेस तो मिलना ही है, ठीक है? So this is for sure for each one of you. ठीक है? Anjita, for AIIMS, the timetable I've already shared. It's ongoing. You can check on the Telegram channel, the last one. Okay. Dr. VK, that's great. And Manoj, like I said, if you're stuck with a stagnant GT score or a low GT score, start using the Medsynapse videos. It will definitely help you. Medico FMG, see, remember, it is not any particular resource or platform that you can blame for not getting a good score, right? There are students who use the same platform and they score really well. There are students who use the same platform and they're not able to crack. So basically, introspect, self-analyze, what is the mistake that I made during the preparation. It might be lack of MCQ practice, it might be lack of revision. These are generally the two things that we need to take care of. Okay? Right. Chalo. So I was telling you about the timetable. So for the students who are specially focusing on the FMGE exam or dedicated NEET PG exam, this is the timetable that you can follow for sure. Okay, so starting from today itself, so if you're not starting today, तो आपको FMT को 3 दिन देने पड़ेंगे. So what I've done in the timetable, this is a total of basically 87 days का timetable. Okay, so these number of days, if you see here, this is 87 days. Along with that, the alternate Sunday is what I have given you free. Basically, no target on that day to give the grand test or the mock test. Why? Because this is another mistake that is done. हम पढ़ते रहते हैं and we think that एक बार जब हमारा ये 19 subjects का cycle finish होगा, उसके बाद ही मैं grand test दूंगी और दूंगा. Please don't do that mistake. You should start giving your grand test right from the beginning, even when you are done with the initial 2-3 subjects. Okay? The grand tests are not to make you feel bad. The grand tests are to help you assess, how do I guess the questions? How do I manage my time? How do I maintain my concentration, my focus during the exam? The more mock test you give, the more time management, the concentration, the focus is what you would learn. Okay? So please start giving the grand test according to this. I have given you alternate Sundays basically to give the grand test. So give these grand tests from whatever platform you want. You can give these tests and keep assessing yourself. Add the points, the learning points from the grand test to your notebook. For the students who are starting to prepare now or otherwise, please have your notes handy. Every time you cannot open an app and revise from there. It's very, very cumbersome. You will not even remember kahan kya pada tha. So please have your notes handy. One subject, one notebook, or basically divide a notebook into the subject sections. Everything of anatomy should go at one place. Everything of physiology should go at one place. Whether you are learning it from the grand test, from Medsynapse, from rapid revision, your volatile topics of a subject, everything should go at one place. Okay? So please start making notes. It takes efforts, but trust me, it is worth it. Okay? So this is the timetable starting from today itself. So FMD 4 days, psychiatry I have given 3 days, microbiology is 6 days, orthopedics again is your 3 days. So basically it's a total of 87 days, right? I put this timetable in sync with the ongoing timetable. And this we are finishing basically on 19th of May. So everybody will be at the same page when the AIIMS exam is done on 19th of May. Okay? So that's why I made this timetable in such a way that the students targeting FMG, the students targeting NEET PG without targeting AIIMS, you finish your one read. Remember, this timetable is for one read plus one revision. This is not just for first read, right? This is for one reading plus one revision. So then you will ask me कि मैम इसमें revision कैसे manage करें. So that's what I've written here is keep the last day of a particular subject for consolidation for revision. So for example, if I have given you 4 days for FMT, the last day, that is 18th of February, or at least half a day for a short subject, full day for a long subject, keep it for रिवाइजिंग वट एवर यू राइट डाउन इन द नोट्स. क्योंकि जब आप पढ़ोगे आपको याद आएगा कि ये बार बार पूछा गया है पिछले एग्जाम में, तो ये आपको लिख के रखना है आपके नोट्स में. एंड इन दैट लास्ट हाफ डे और लास्ट डे रिवाइज दीज पॉइंट्स. दैट इज हाउ यू विल फिनिश वन रीड and one revision. And I've given you good number of days to complete the subjects. जैसे psychiatry 3 days दिया है, so 2.5 days finish off understanding, consolidating the matter, the content at one place from wherever you want to do it, whether it is first aid, it is Medsynapse, it is your primary resource rapid revision. सब कुछ content, previous year question content, everything should come at one place. Remember, so many days that I give you for a subject is basically to get the content at one place. So when you are revising, everything is at one place. After 19th May, when we start the next cycle, you just have to go to one place to revise. You will not be going to multiple spaces. So basically this cycle is to get everything at one place. Post this cycle, I don't want any one of you to be going here and there. Okay? Medico 1606, if the AIIMS preparing students want to follow this timetable, you can do this as well. Just that try to decrease one day from this timetable so that you get some days in the end for revision as well. Okay? So basically, if you will reduce one day, so for example, anesthesia I have given 3 days, psychiatry I have given 3 days, rather than that you do it in 2 days vagera. So what will happen is you will get 19 days extra saved, and in that 19 days you plan one more revision. That's how you can customize this for the students who are preparing for AIIMS. Okay? Is this clear with everyone? Yes, Medico FMG, that's the spirit there. Yeah, so if you are just targeting FMG exam and you have read well in your undergraduate days, just using the Medsynapse app can help you get to that 150 score. So, like I said, Medsynapse along with the PYQs, along with rapid revision of any other platform makes it a very good combination. Okay? So this is the plan that I have. Radiology I've kept at the last because basically radiology is your amalgamation of all the subjects, be it ortho, peds, medicine, surgery, everything, OBGY, and that's why I've kept radiology at the end. So by 19th of May, you are finishing this one read plus one revision. Remember, try to keep the last day for revision, for quickly revising whatever you have at one place. Okay? Is this clear with everyone? या निहार, एक्चुअली यू नो द मेडिसिन का जितना हम हाइप करते हैं ना, उतना पूरा डेडिकेटेड मेडिसिन पढ़ने की जरूरत नहीं है. मेडिसिन इज बेसिकली योर फिजियो, फार्मैक, माइक्रो, पैथो टुगेदर. So if you look at the previous year questions also from medicine, you will be able to solve majority of the questions from your basic subjects ka knowledge, right? So that is why in the timetable also, if you see the primary subjects, that is physiology, pharmacology, pathology, microbiology, I've kept it before medicine, ताकि आपके ये सब subjects हो जाएंगे तो बाद में ये medicine cover करना in 7 days will be very very easy. So honestly, trust me, and even if you see the interviews on YouTube of the toppers, they will tell you that medicine is something that they had left out, right? So once you finish your basic subjects from the medicine, just try to do the previous year topics, dedicated topics that you need to do there, right? Okay, so this is the timetable. Now coming to Short 5.0. Basically, this is the course that you have, a really concise course which is entirely filled with a lot of mnemonics and concepts for all the 18 subjects, right? Along with this is in complement to the Magic Book 5.0. So magic book, the short magic book is available for purchase separately for the students, whether you are a subscriber or a non-subscriber of Medsynapse app. You can still buy that book. It can be bought from the Medsynapse Academy website or even from the app. In the app, in the Android, you would see that magic book option. In the iOS, you will see it in the store wala option. So the magic book is available for a pricing of $5.99 with the shipping included. So the first thing that you should be doing is ordering this magic book, so that when you start watching the short 5.0 videos, you can make the notes in this magic book itself. And this is really good for your one day before the exam revision. Okay, the core topics, like I mentioned, has been covered. So here in the bracket, basically it tells you the number of hours the subject has been covered in the short 5.0. Where is this available? The videos are available in the Medsynapse app. Okay, the videos are available in the Medsynapse app. Let me quickly show you that. So this I'm showing you basically from the website, the medsynapseacademy.com. And if you see here, basically you have the multiple courses available here. So you have 1 month plan, 6 month plan and 12 months plan at negligible prices, because the primary motive here for me is not to become a millionaire or billionaire out of this, but basically to help you guys crack this exam. That is the honest, pure intent that I have, and to simplify the 19 subjects for you. 18 on Medsynapse, the 19th Radiology and Prep Ladder. Okay. So you have 1 month plan, 6 months plan and 12 months plan for the students who are giving the FMG or the NEET PG exam. If you're taking the subscription now, you can go with this 3499 6 month plan. For the NEET PG 25 students, start using the Medsynapse app right away. You can take this 5499 ka 12 months ka subscription. Okay. So this is what you have. And let me show you the content basically which is there in the app. So this is the content here, and in the content basically if you see here, this is the short 5.0 plus PYQ KBMD available. This short 5.0 has the offline class recording. So because it's not possible for me to travel everywhere, the offline class recording, I've made it available in app. So you will feel it like it's one-to-one interaction classes there. So it has all the videos there. You can see anatomy is 3 hours, physiology is 2.5, biochemistry is around 4 hours, pathology is around 4 hours, right? So this is what you have there. Okay, this is the PDF that you have. Basically for biochemistry short, like you can see, this is how the topics are being covered. You get the annotated PDF in app download as well. Okay, and all the important topics, ETC inhibitors, then you have hormone sensitive lipase, fed fasting state, all the core topics have been covered. Enzyme inhibition, competitive, non-competitive, the graphs there, enzyme cofactors, how to remember with all the funny mnemonics there, right? Selena Gomez ke beautiful thighs, that is the mnemonic you see there. All the disorders, amino acid, lysosomal, glycogen storage, all the disorders have been covered. And trust me, for biochemistry, if you do this much, majority of the questions will be cracked, whether it is FMG, whether it is NEET PG or whether it's AIIMS. So 4 hours of biochemistry and you'll be done with that, and that's my promise. Okay. So basically, this is the short thing that you should be following. Along with that, in the short 5.0 ke saath, you have the FMG PYQ marathon, which was conducted before this exam. Again, the topics that have not been covered in short have been covered in this FMG PYQ marathon. So NEET PG students, AIIMS students, you have to watch this PYQ marathon for sure. First, you will learn a lot of MCQ solving cheat codes. Second, the lacuna in the short 5.0, the topics have been covered here. Okay, so like for example, this is physiology ka PDF. Okay, so look at this. A lot of topics like your nerve fiber classification, the JVP, and you can see all the important questions that have been covered here, along with your the GLUT receptors, mnemonics have been covered, the GLUT transporters, right, and a lot of things have already been covered here. Okay, so please, like the cystometrogram, everything has been covered. So please do not forget to watch this PYQ KBMD also. In the main videos, what do you have is the extra topics as well, along with the SureShot 5.0 topics. Like the spinal cord tracks is not there in SureShot 5.0, it is there in the main videos. So what you can do is, you can first watch the SureShot 5.0, then you can go to the main videos to see the topics that are there in the main videos and were not covered in the SureShot 5.0. Even in SureShot 5.0, if you think any topic was like very short, you can cover it in detail from the main videos, right? So that's how basically you should be using the Medsynapse app. Every subject also gives you this PYT PDF here. Anatomy 2017 to 2023 PYT PDF has been given. This is for all the subjects. So if you look at the content here, the SureShot also gives you the PYT PDF, right? So you can see the PDF here. Because it's on website, I cannot show you this content here. It's only app accessible content. So all the PYTs have been given to you, both the NEET PG and the AIIMS. Okay, so make use of this PYT PDF to understand कि in a particular subject, what are the topics that I need to focus on. So even before you start, so for example, like I was talking about your timetable, जैसे अभी आपको FMT करना है. Let me give you this example. Okay, so example, you are starting with psychiatry. What is the sequence, how you should be doing or approaching a subject if you are starting with this timetable? First thing, with the app, the platform that you are using, any other platform which has the PYQs, quickly see the PYQs of the subject. कि psychiatry के PYQs मैंने सिर्फ देख लिए. Even if I know the answer, I don't know the answer. Just to understand कि what type of questions are being asked in a particular subject, right? Second, you go to the Medsynapse app, you watch the SureShot 5.0 videos, and from the main videos, you watch the extra topics. Please make notes of this, very important. Then you go to the rapid revision of another platform, like the Prep Ladder rapid revision is really good. So once you finish with Medsynapse videos, go to the rapid revision of another platform, add on the extra points, right? Fourth and the last step is, again you solve the PYQs now as a test, okay? And whatever notes you have made or whatever ready-made notes you have, whether it's your Prep Ladder notes or the magic book, in that you highlight the previous year question topics along with the year. So for example, when you are solving psychiatry, NEET PG 20 ka question. So go to your notes and one by one you highlight with your, I always say that for the PYQs, use the pink highlighter, because you'll remember PYQs is the pink highlighter. So pink highlighter say you highlight the PYQs, and besides that you write down कि this was the question asked in NEET PG 20. This was the question asked in AIIMS 20, AIIMS 21, right? So that the last day that I told you कि भाई revision के लिए रखना. So from your notes, you just quickly revise these highlighted areas. So at least that is done. Okay, at least that is done. You are revising at least that part. So I hope you've got a clear path now on how to start studying. If you are lacking the direction, this will definitely give you a direction on how to approach the subject. Is this clear with everyone? Yeah. Happy? Prep ka RR is actually enough. It's good. And it's possible to complete in 2 months. ठीक है, बहुत ज़्यादा नहीं है उसमें, सिर्फ required content है. Is rapid revision enough if the concepts are weak? See, what you need to do in that case is start watching the rapid revision videos only for the areas where you think कि मुझे ये समझ में नहीं आया from rapid revision. For that particular area, you watch the main videos. Please do not do that mistake that you will start with main videos and main notes. Problem आता है revision में. So something which you are not able to revise, please do not read it in the beginning itself. Okay. The total duration of SureShot 5.0 Hemang is around like 35-40 hours. Okay. Naveen, for the old timetable followers, will we have any rapid timetable during April and to May? Definitely yes. Before your INICT exam, we are going to do in-app short, right, with the INICT extra edge topics as well. So is this clear with everyone? Right? So for the students who are starting now versus the students who are done with the first reading, the students who are starting now, you can start with the Medsynapse main videos, do the rapid revision, do all the KBMDs along with the PYQ marathon in the app. Okay. For the students who are done with the first reading, you can directly start with short 5.0, revise your primary resource and do the KBMD and the PYQs. Please make use of the PYT PDF available in the app. It's available for everyone, right? So what to study first in a subject? This is where your PYT PDF, which is available in the Medsynapse app, will help you understand कि एक particular subject में से कौन से topics important है. ठीक है? Is this clear with everyone? And for your last minute revision, use your magic book, the short 5.0. In that, the PYQ topics being added, being annotated. That will be a good thing basically for your last day revision. Okay? I hope I have made all the points clear here. Right? So remember that these are the questions that we have during the preparation. सबसे पहले क्वेश्चन होता है कि what to do, what to study. फिर आता है कि अच्छा ये पढ़ना है, but ये पढ़ना कैसे, how to do it. And then comes the willingness to actually put that effort to do once you have understood what to do and how to do. Right? And this is the most important part basically that will determine your success. So what to do basically is wisdom. How to do is developing that skill, understanding that skill, and actually doing is what is the virtue, right? So remember that you will not crack the exam just with the wisdom or just with the skill. You need to have that virtue of actually doing it day in and day out. You know, there will be days where you will feel like not studying. Please take a break if you want. But you do not break down. Okay, very, very important. Break lena hai le lo, but aap break down mat kar dena. So taking breaks is absolutely important. Whenever you don't feel like study, just get out of your chair, go for a walk, listen to some music, right? So that's the time you work on your PQ, the physical quotient, the EQ and the SQ. तो जब IQ काम नहीं कर रहा है तो PQ, EQ और SQ वो वाले एरियाज को टाइम दे दो. Remember, you have to give time for all the 4 pillars. It is very, very important. ठीक है? So look at it as a long race. It is not just a short race that you are running. ठीक है? In the process of this short race, do not compromise your long race of life. Please cater to your PQ, EQ and SQ also. Very, very important. Okay, very, very important. So this is your timetable. I'll be sharing it on the Telegram channel also. We will be having a lot of live classes also in the app. I keep you posted about the same in the Telegram channel and you get in-app notification also कि जैसे जब FMT है आपका तो FMT का session, one FMT session is what I'll plan. जब psychiatry है तो psychiatry का session होगा, microbiology होगा. So to add on, there will be microbiology, KBMD, right? All of that will come in play. So what and when, how the live classes will be there, I'll keep you posted. So stay connected on the Medsynapse app. At least if you're not subscribing, at least download the app, register there because there are quite a few free lectures also which keep happening. So don't miss out on those as well. Plus you get the free PYT PDF on the app. So make the best use of that as well for your exam. And the NEET PG INICT students, please solve the FMG PYQs also for your exam. You would see a lot of overlap and repeats coming from the FMG PYQs also. Please do not neglect that part. Deepika, fast series for biochemistry and fast series for microbiology is what we will definitely have. I could not do it with biochemistry previously, but we are definitely going to do it in the coming days. Okay, any other queries before we call it off for this session? And yeah, for all the app subscribers, we are going to meet again in some time at 8 p.m. basically for KBMD of ophthalmology. So you have finished ophthalmology recently before neurology for the students following the system-wise timetable. So 8 p.m. you have ophthalmology KBMD in app with the live poll, the live leaderboard there. So do join in for that as well. So that was for this one. And so all the FMG students, the NEET PG students, let's get started with this. Thank you so much. Anusha, you are currently following system-wise but didn't get the confidence yet. If you think that it's not working that well, the system-wise, like I said, you can go ahead with this subject-wise timetable. If you are targeting AIIMS, subtract one day from the subjects. If you are totally focusing on NEET PG, go ahead and follow this timetable afresh. Revision is the key. You will only get the confidence with the revision. Happy, I'm really bad with such questions, be it the questions related to the exam eligibility or the counseling, right? Your prospectus, the AIIMS exam prospectus is your best place, basically, which will help you understand what is the eligibility. Sarvata, the split screen issue is there in iOS recently since last 3-4 days. We have already notified the team and we have sent the request right, to get it back in place. As you know, the iOS takes some time for the changes to be incorporated. So it will be done for sure. Let's have thoda sa patience for next a couple of days, I believe. Yeah, so it was working previously, but due to some issue, it's not working now. But we have already raised the request for that feature to be rolled in again. Okay. All right. Thank you so much, everyone, and all for all the Medsynapse app subscribers. I'll see you again at 8 p.m. for the in-app live KBMD ophthalmology sessions. A session where you would learn a lot of MCQ solving cheat codes in ophthalmology. So get ready for that. So that was for this one. Let's kickstart our journey starting with FMT. And I'll keep you meeting in the YouTube live sessions and in the in-app live sessions as well. If you have any other queries, please feel free to drop me a message on the Telegram group or even on Instagram. You can DM me. Thank you so much, everyone. Goodbye. Take care and keep studying, keep med synapsing, keep revising, and keep winning. Thank you so much.